News Talks. UJR.
Good evening, everyone, and welcome to the special live radio show with Dr. Doug Thompson. With over 25 years' experience in state-of-the-art oral health, Dr. Thompson will be talking to us about the serious connection between gum disease and most of the major diseases of our time. He'll tell us about where his research has led him with respect to avoiding these silent killers. He's joining us tonight in this rare opportunity to call in and speak with the doctor directly. You won't want to miss what Dr. Thompson has to say. And if you have a question for the doctor, we're inviting you to call at 800-859-0957. So stay tuned and we'll be right back after this short break. You're listening to 760 WJR. Okay, so what do you want to start with?
Your call. I mean, we can, if there's something that wasn't clear from the Sunday show, we could reference it, and then we could talk about the Sunday. Some of the Sunday questions that maybe weren't so clear, or maybe they got rushed.
I thought Sunday was pretty. You did a great job on Sunday. Actually, you were very clear. I just think that it's always a good idea to reiterate that what you've got going is this medical diagnostic model that's very simple, easy, and covers a huge ground that no one else is doing. And that's what the most important thing is.
Okay.
Because when anybody's looking to go to the right dentist, that's just an add-on. That's like an incredible add-on for your overall health, which ultimately is probably worth more than your teeth.
For
Right?
sure. Ultimately. Yeah, for sure. Absolutely.
And so, I mean, as I said before, you're one in like a handful of people that does what you do.
Yep.
And so I think that's really important.
And if you recall the Sunday show, we talked a lot about cavities in children and
Right.
issues with cavities, and there were a lot of concepts that got tossed out that we could talk about. So if you want to reiterate any of those, but obviously for the Wednesday audience, always going back and talking about what we do and why it's significant is always a good thing to recap with.
Welcome to the special live radio show where you can call in with your questions and talk to the doctor directly. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Doug Thompson, integrative oral health dentist from Bloomfield Hills, Michigan. He's here with us discussing his state-of-the-art clinic and the latest diagnostic tests in oral health care and the importance of the connection between the mouth and many systemic diseases. If you have a question for the doctor on the matters we're discussing tonight, please call us at 800-859-0957. Dr. Thompson, always a privilege having you on the show. There's so much that we have to ask you, so much patients and listeners need to know. We all have dentists, but none of us, or very few of us, have a dentist that does what you do. And for new listeners, I just want to go back and ask you again, talk a little bit about what you start off with and this preventative program that you have to tell people and evaluate their overall health before you start looking into their teeth.
Well, Anne-Marie, thank you for having me. It's an honor to be here. And one of the things that I wanted to make sure that we talk about or discuss is, dentistry's come a long way from just filling the results of disease. And what I mean by that is, like, if you take a cavity, a cavity is really a result of a much more sophisticated disease process. And so in our practice, we don't want to just fill the cavity, but we want to try to figure out what caused it. And what we're starting to realize now is that there's a group of bugs that live on and around the teeth and in the mouth that have a significant effect on your systemic health. And so what we're looking at now is more of what's the root cause of some of these diseases. And there's people in the listening audience, I'm sure, that have been plagued with years of fillings and root canals and crowns and lost teeth. And they're trying to figure out, why did this happen to me? Because I kind of thought I knew how to brush my teeth. And the reality is that most of these diseases are not diseases of neglect, or not because somebody didn't take care of themselves. It's because they had a certain susceptibility, or they had a certain, maybe even genetics played a key piece in this. And, they get these diseases. So now when people come into our office, we can do some simple tests using the saliva as basically something that we all have. It's a very easy thing for them to do, and we can start to look at some of the components of the saliva, and if they're dangerous or unhealthy, we can get them to people that we can help them, and then we can get them to people that can look at other diseases. We're up to 57 different cross-reference diseases now that deal with the mouth. 57. So when you think about your mouth and you think about, just a cavity or gum disease, it goes way beyond that. And so in our practice, we start to look at not only the current conditions, but how could those current conditions relate to oral systemic health?
And also, I think the most important thing here is we all know that most people know that there are normal flora in your mouth, and there are also oral pathogens in your mouth. No one's looking at them. Well, you are, and a couple of other dentists, but not too many dentists are looking at them. But I think what I take away from your shows and your information and your practice is how terribly important it is to identify those oral pathogens, because they are the start of the disease. They're not the result of the disease. In other words, it's not like cardiac disease is causing you to have oral pathogens. It's the other way around. And we all know that aside from the 50, or included in the 57 that have been identified, that Alzheimer's, which is one of our biggest fears next to heart disease, is once you get it, it starts in the mouth. That's where it begins. You don't get Alzheimer's and then you have the pathogens in your mouth. No, it starts in the mouth. Someone has to find it in your mouth. And it's not going to be your doctor, your primary care physician, your cancer specialist, or any of your other specialists. It has to be done by a dentist.
Yeah, and you're embarking on something that's pretty interesting, because dentists are in interesting times. And we have a situation right now in our community, in our local community, where we have physicians that are really in tune with the kind of significance, the absolute significance of oral pathogens, and what the oral pathogens could do to you as a person. And so what these physicians are doing now, and Brian's on your show all the time. Brian, we work together sometimes, and he'll do the oral DNA test in his office.
Right.
And so that's what dentists would do.
Sure.
So now I actually have it going the other way, where I have physicians that understand the significance and the importance of the oral pathogens. They're doing the test. They're sending patients to me and saying, what do we do with this? How do we take care of this patient? So it's an amazing opportunity for us, because the whole medical world knows that these bugs that live in the mouth, if they're imbalanced, if they're improper, or if they're if it's the wrong kind of makeup, you could be significantly affecting your health. And what a gift if we could find these bugs for people in their 30s and early 40s and late 20s. I mean, it's amazing what we could do for these people. So it's an interesting time, because now we used to think we should only look at bugs on people with a lot of significant oral disease. Now I think we should look at bugs on everybody. We should be looking at bugs on everybody.
100%. And also, I always say, even in Dr. Collander's show, we talk about the fact that you need to get in when you're 20, 25, 30. You can't be too young to get started out in identifying what is in the mouth and what we can do to put a halt to it and kill those pathogens before they get into the blood system.
Yep. And I know we only have a few seconds left, but I can tell you, we used to start doing gum mapping on people in their 20s. We now do it as soon as all the baby teeth are gone. Sometimes it's 12, 13, 14 years old. Kids are getting their first gum exam in our office.
So let's come back and talk some more about that on the other side of the break. In the meantime, you're listening to the Dr. Thompson radio show. He's here tonight talking about the seriousness of undetected oral pathogens, which can be the root cause of many catastrophic diseases. If you have a question, you can call us at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to call and talk directly to the doctor. You are listening to the Dr. Thompson radio show on 760 WJR. And we do have a call, so we're
great.
back on Facebook. So,
great.
this can't be emphasized enough that the age to start with all of this is because Collender talks about this. He gets people that come in their 20s.
Yeah.
And then he finds out that, well, you're in serious trouble. So, this idea of if I'm young and I'm exercise and I eat well and I'm vegan and
We see
that doesn't mean anything.
we see some very young people that come in and we get them some testing and we find out they have significant disease at a young age. And, and I'm sure Brian Colliner talks about it, but the American Heart Association is now recommending that kids get their cholesterol checked between 9 and 10 or
why
9
not?
and 11. So, this is no longer a disease that we thought it was an old person's disease, but it's crazy. And when you have physicians and doctors who are waiting until their arteries are 90% blocked, do you know how many years ahead of that you could start doing some preventative measures for people? Years.
Plus, also, if you catch people early enough, the testing, taking a swab of saliva out of your mouth is 100% easier and less stressful than having to go into the hospital for a procedure that snakes through your veins into your heart. Some of those very intensive tests that they do to diagnose heart disease are draconian. And so why not find out before you have the symptoms, before you have the plaque, before you have the disease?
No question. And we have beautiful papers that talk about beautiful scientific literature reference papers that talk about the significance of finding this disease early and what even dental hygienists can do by having people come into the dentist more frequently. The 6-month thing that was set up by insurance companies, but people need to come in even earlier. And if they come in earlier and more frequently in keeping the bacterial population low, you could prevent the onset of some of these diseases by years. So it's amazing. It's just amazing what the opportunity is for us.
Yeah, and it's easy and it's simple and it's not invasive and it's not even that expensive. The tests are not that expensive.
And we can talk about all of those things, the ease and the expense. It's the people should know.
Okay. And I'm going to take a call. You still have Greg on the line, right?
Yeah.
So we'll just take his call because he's been patiently waiting. Welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne-Marie Cronin, and we're here tonight talking with Dr. Thompson, general dentist and oral health specialist in Bloomfield Hills, Michigan. He's here with us discussing the latest diagnostic methods he uses to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor, please don't hesitate to call at 800-859-0957. And Dr. Thompson, before we come back to continue on about your practice and your preventative methods in your practice, Ashley, you've got a caller?
Yes, we have Greg calling from Shelby. Greg, what's your question?
Hey, good evening, Dr. Thompson and Anne-Marie, Mr. Positive. Hey, got to tell you, Dr. Thompson, you're a revolutionary and you're an iconoclast. I love what you're articulating, the relationship between germs and inflammation in the mouth causing serious chronic diseases. I'm going to make it a little bit less, but is there a relationship as to, do you brush your teeth first, then mouthwash, or do you mouthwash and then brush your teeth?
Yeah, Greg.
My cousin was a dentist.
Yeah. Thanks for the kind words about what we're doing. It's an uphill battle, but we're early in the game with this whole this whole deal, but it's time for the public to really be aware that what's in your mouth goes way beyond your mouth, and it's something that we call like the traveling oral microbiome. To answer your question, should you brush first or rinse first? I really think one of the things that we want to do is clean in between our teeth first. So whatever methodology you use to clean in between your teeth, you want to do that first, because if you're going to use a rinse or a paste, you want it to get in between the teeth. So you got to get the food out first. So you clean in between your teeth. You want to use floss, brushes, water pick, however you want to do it, you should do that. Then if you want to use any kind of antimicrobial rinse, first off, I don't think anyone should use a rinse unless you have a good reason to use a rinse. Then you would want to use the rinse next. And then the last thing you want to do is brush. And the only reason you want to brush is because in basically the old days, and not even too far long ago, the therapeutic value of toothpaste was fluoride. And so you want the fluoride to sit on the teeth for a little bit. And you want that film of fluoride to be on the teeth, throughout the morning. So you wouldn't want to rinse it off right after you brush. However, today we have many anti-fluoridated pastes. We have other things in paste that people are using, but the idea is still the same. Clean out in between the teeth. Go ahead and use any kind of antimicrobial rinse. But again, I'd love to know why or what rinse that's a whole nother show. And then brush last. That's the order that we want to do that in. Some rinses, by the way, some rinses will cause some paste will cause the rinses to be ineffective. So that's why we use the paste last. We don't want to make the paste be ineffective, and so that's why we rinse in the middle.
Thanks for calling, Greg. Anyway, it's very important, and I think most people are lost because they don't realize, number one, how they need to take care of their teeth. Because you're talking about, rinsing and using a water pick and getting in between the teeth and getting rid of the food, first of all. But again, coming back, as I always favor coming back to the diagnostic tests that you're doing, tell us a little bit more about some of these tests that you do in your office prior to taking a hard look at what's going on in their teeth.
Yeah, well, one of the things that we want to do is a very thorough gum and bone exam, and part of that gum and bone exam is looking at the architecture or the supporting structures of the teeth. And if we have any kind of issues with the gum or gum recession or loose teeth or flaring teeth, we know that there's a certain component of microbes or biofilm, if you will, that causes the problem for your body to react and make those, create inflammation and create systemic health problems for you. So the first thing we'd like to do is to analyze what's the makeup of that biofilm. And it's really easy. I can give you a little saline, a little bit of solution you can swish in your mouth, and then you can give that back to us and we can send it to a testing laboratory, and the testing laboratory can analyze it and tell us what's the concentration and the presence of certain microbes. And then we have strategies in the office for how to suppress, eradicate, or alter that combination. And so we're either looking for suppression, and to Greg's question, when, Greg called us and talked about a rinse, I wouldn't put anybody who's healthy, who has a good oral microbiome or good balance, I wouldn't put them on a rinse. But for somebody who had an imbalance and they had some of the wrong bacteria, then we surely want them to be on a rinse, but we want them to use the rinse in the right order. So again, the question was very prudent. And so to go back to your question, Anne-Marie, the tests are very easy. They're inexpensive. Some of them are under $400. Some of them are under $300. They're very inexpensive tests. They're not covered by medical insurance, unfortunately. We'd love to have all of our tests done for free, but that's not the way medicine works today. And
well, prevention isn't covered. We know that. I mean,
right.
Most of the preventative tests are not covered. Screening, yes, but even the screening's in a sad situation.
Right. So if you have any questions about, anything that I've said thus far, I don't mind going back and recovering that. But yeah, these tests are inexpensive. They're easy. I get results in a week. Sometimes I get results in as short as 3 days. And we can learn a lot about the makeup of someone's saliva, which could be so important just to their overall health. That's the big message. Look, find out what's in your mouth, find out what could be in there that could be harmful, And if it's beneficial or if you're healthy, no problem. But if you're diseased or you have a big problem, you want to know about that.
Absolutely. And I think, what I take away from your practice and what you're doing, and it's absolutely, consistent with prevention and all the tests that you're doing with your patients as they come in. First thing that happens is they're going through this screening. And we know that almost everyone in the country is afraid of cardiac disease, one of the biggest killers, one of the biggest problems in the country, but we're equally worried about people getting diabetes early, getting other diseases early. So, what I take away from your practice is that everybody, regardless of who they are, as soon as you can, get in and get that oral test where you're looking at the saliva, you're identifying the pathogens, and then you're able to do something about it. So let's presume you get a client who comes in. How much is this test to do the oral test?
The oral test could be as little as 195, depending upon what I need to do. It could be as much as 375, but it's a very inexpensive, affordable test. And one of the things that it tells us, it helps direct treatment for us. It helps us decide who needs something and who doesn't, because part of what we're doing in the initial screening, and when you say screening, we're also doing something what we call a risk assessment. And so the idea, Anne Marie, is in our practice, I would love to provide everything somebody needs and nothing they don't. In other words, a lot of practices, we're doing too many procedures that we don't need to do.
Right.
And we're not doing enough procedures that we need to do to really figure out who's who. So if you have high risk and if you need something, I want to make sure we can provide that for you. But if you don't need it, I don't want to do it. So in other words, and we decide that, and that's based on risk. So part of the new patient screening is a risk assessment analysis of what they need and what they don't. And I think we spent way too much money keeping people alive when they're dying. We haven't spent anywhere near as much money keeping people well when they're alive.
Oh, well said.
That's
well
the idea.
said.
That's the idea.
We should have a plaque made of that speech. That's very well said. You're absolutely right. It's the quality of life. It's avoiding the disease. And coming back to this test, once you take the saliva, you send it out, it comes back. Are you able to then get rid of these pathogens before they become dangerous?
Totally. We can get rid of that. And if you ask me what I've done in my professional dental career, it's probably starting to rewrite the book on how we care for this disease. Because in school, I learned something very different than what I've learned in clinical practice. And that's what I teach dentists all over the world, how to help do that. And so we could have a discussion about the dental education piece and what we do.
Well, we certainly need more dentists who are doing what you're doing and who are more into prevention and certainly preventing all of these deadly diseases. And it can be done. We're fortunate. In the meantime, we're going to take a quick break. You are listening to the Dr. Doug Thompson radio show, and we are talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you should call the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to ask your questions directly to the doctor. You're listening to the Dr. Thompson radio show on 760 WJR. And welcome back to Facebook Live.
Yeah, so part of the mission, and when we talk about this on the radio, part of the mission is trying to get other dentists in other parts of the world, because, your listening audience, and now we're on Facebook. I mean, who knows where the Facebook listeners or audience is? We need to have dentists all over the world that know how to do this.
Right.
So part of my journey and part of the journey of my clinical team and my support staff is to help other people around the world learn about this as well. So we have people that we're helping in England, New Zealand, Spain, Italy, Canada, all over the world. We're trying to help dentists through our Wellness Dentistry Network learn about this modality and figure out how to be ambassadors in their community for this message. And so
I think that, dentistry in general, and a lot of dentists are just kind of stuck in a rut, and they do what has been done for so many years. And then you get a annual checkup and you go in and you get your teeth cleaned and you see a hygienist and then you get x-rays and then you see the dentist and then you're out, and then that's it. There's no talk about the investment of time, and let's talk about your health, because all of what's going on in your mouth is affecting your overall health.
Yeah.
And so this is a remarkable, we have the technology now in this country, and I think it's a remarkable opportunity for everybody should line up and get in with a practice like yours where you're doing this. And it's great that you've got this wellness dentistry network where you're teaching other dentists. They should all be doing it because it's not going to happen in the primary care physician's office. It just won't.
Yeah. No, it won't happen there. And we're the people who can take care of the issues when we identify them and we present and they present to us. We're the ones who can care for them. Unfortunately, patients haven't been taught to value their health or their teeth the way they should be. And so we have to, that's why we're spending so much time and effort trying to create this public awareness campaign, because we want people to know how, we want people to know how valuable and how life-saving it could be, but it's going to come out, it's going to continue to come out stronger and stronger in the future. But we're, that's what we're trying to do. And it's hard because people won't move or be motivated to do anything that they don't value. And if they don't value this, or if they don't really understand it, then they just think it's optional. I can tell you, your teeth might be somewhat optional for some people. You can get by with no teeth, but I can tell you what, you can't get by without a heart, and you can't get by without a brain, and you can't get by without certain pieces.
Right.
And what we do affects that way, way long before the disease officially sets in. So
are we going into segment 4, Mark?
3.
Oh, why don't I remember these things?
Oh,
4. Thank you. I thought so.
I'm sorry, not 5.
No.
Sorry.
3, not 5. 4. Okay. I think that's like probably the most important topic is what you're doing because people don't realize. And it's like the tests aren't that expensive and you're not doing them all at once anyway.
No, only for those who need them.
You have a caller? Okay, who is it? Dave?
Gary,
Okay, from where?
Chelsea.
Okay, let's come back to the caller and get that out of the way. Okay. Welcome back to this special edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we're here talking with Dr. Thompson, dentist and pioneer in prevention from Bloomfield Hills, Michigan. He's here tonight explaining the medical diagnostic model he incorporates in his clinic to screen for many of the catastrophic diseases, from cardiac disease to Alzheimer's, that through early detection can be prevented. If you have a question for the doctor on the topics we're discussing tonight, please don't hesitate to call at 800-859-0957, and you will be talking to the doctor directly. But in the meantime, Ashley, you have a caller?
Yes, we have Gary calling from Chelsea. Gary, what's your question?
Good evening, Anne-Marie, Dr. Thompson. Thank you so much for taking my call.
Welcome.
Appreciate the show and all of the discussion tonight. So, just a little background. I am 35 years old. I am a congenital heart patient. I've had 2 open heart surgeries, aortic stenosis. Ever since I was little, I've had to take amoxicillin before any dental appointment. I'm fortunate in that I have a healthy mouth, but my question is, as I'm getting older, approaching 40, and listening to your advice, and I heard the other gentleman ask about order of brushing and flossing, and I know you don't want to do too much of the show on the importance of rinsing or lack thereof, but what advice would you have for patients like me who have a congenital issue, especially being a heart patient, going forward as I approach midlife? I mean, with the importance of amoxicillin, I have to be honest, when I was young, I kind of blew it off, but hearing you and even my own dentist, it's vitally important. Could you just touch a little bit on patients who already have chronic issues and people like me? What should we be doing? What should we be looking for doing special?
Yeah, Gary, I appreciate your question. And, your situation is, first off, I'm very compassionate toward what you have to go through and what's in front of you, because I do think that it's going to be super important for you to stay safe as you go through certain kinds of care. And what's happening is if people have certain parts of their heart that are working maybe a little bit either inefficient or or maybe it's more at risk for infection, the whole medical world knows that when you go and scrape around all the teeth, you release a whole lot of bacteria in the bloodstream. So about 45 minutes after the time we start doing our work around your teeth, there's a significant insult to the body from bacteria. And if you happen to have the wrong bacteria, now we happen to have a way of to test you to find out if you have the right or wrong bacteria. But if you have the wrong bacteria, it can affect the parts of your heart that might not be as efficient as somebody who doesn't have the kind of genetics that you have. By the way, everything you have is not your fault. It's a function of your genetics and it's a function of your environment. So yes, I think the amoxicillin is very important. You need to have that. But more importantly, you need to, Gary, I don't want to say you need, but I want to recommend that you see somebody like one of the other talk shows that are on and the health shows that Anne Marie hosts, but Brian Colander, because there's a relationship between a genetic component of your cholesterol called Lp(a) and aortic stenosis. And we need to find out, do you have the genetic piece that could make you, even more susceptible? And if that part's not being managed properly, then in addition to your oral hygiene and your oral situation, then that could be even more contributory. So when you ask me that question, it's a loaded up answer. And so I want to make sure that you see somebody who can help you determine that. And if you have that, we want to make sure when you come in the office, believe me, we're very aware of the conditions medically that put you more at risk. And we want to make sure we cover you and we identify you properly and we take care of you in the practice. So your question's a great one, but I believe that you need, because of the aortic stenosis in such a young age, 35, Gary, you're just getting going. I mean, you got a long time to go. So we want to make sure that you're healthy and that you could have increased vitality and longevity, and you're not a victim of part of your genetics. And we can help you with that, and so can the other medical professionals on this team.
Well, thanks for calling, Gary. And, Dr. Thompson, my question as I'm listening to you answer it, first of all, I was shocked to hear how young he is, not how old he is. And he sees himself as being like middle-aged, and he's already got this very serious situation going on. And it would just be curious to know whether his dentist is actually doing these pre-diagnostic tests that you're doing. And I wonder if he had gotten to somebody, say, when he was 20 or earlier, maybe his cardiac disease could have been diagnosed.
Well, there's no question that it can be, and we're looking at blood profiles on people that are much earlier and much younger. If you're a man 50 or younger and you have gum disease, you have a 72% chance of having cardiovascular disease. So I would love to hear from other callers and find out what some of the questions are. But Gary's question's real, and that's a big concern. We have lots of young people with significant diseases, and they just need to be identified. And if they can create the right network and team of professionals, there's no reason Gary shouldn't live a long, healthy life. But that situation needs to be managed appropriately.
Yeah, I mean, everybody should get into a practice like yours where they do this pre-screening and pre-testing so they can avoid diabetes and avoid all these deadly diseases. But Ashley has a caller, so who's
Yeah,
calling?
we have David calling from Windsor. David, what's your question?
Call dropped.
Oh, we lost him. All right, well, we'll come back to David then. But, it's just tremendously interesting, and you just wonder how many people out there are, falling in the gap because they're not getting these tests at their doctor. So it's just really going to be left to the dentist and the dental practice to carry out these types of pre-diagnostic tests.
Well, what we're trying to do in dentistry is create a big awareness about, and with dentists as well, is to train our teams and especially our hygienists. The hygienists in the office have an hour or 45 minutes with all of our patients. And if our hygienists have if they're armed with a little bit of health knowledge, it's amazing what your hygienist can do to help you with small areas of your life that would be really impactful. So I understand we have David back.
Yeah,
If we
David's
could,
back. Yeah.
we could talk to David.
David,
Yes.
what's your question?
Yes, my question for you is this: what with the amount we hear so much about fluoride and fluoride substances in water and stuff like that, what can you suggest about fluoride in toothpaste when there's too much of it being resolved that can cause a lot of problems to the mouth and in the rest of the body as a whole? What can you suggest about some of the pros and cons about fluoride?
Yeah, David, this is a really dynamic question, and we could have hours and hours of conversations about fluoride. And we have two kind of, pitting entities in dentistry. The American Dental Association has investigated fluoride for years and has found nothing detrimental to it. However, other health organizations have strong evidence to show that fluoride, especially in quantities that are too high, can be detrimental. But I can tell you, I have people that are anti-fluoride that have children that are losing 7 or 8 teeth, baby teeth, because of rampant tooth decay. So fluoride, the big problem that we have with fluoride is our society has forced us to drink it and absorb it in our body internally. I can tell you that topical fluoride for some situations, in some controlled situations, can be very, very beneficial and save some teeth for some young people. However, we need to know that fluoride can cause some thyroid issues. It can cause some other health issues. So fluoride needs to be used very judiciously. And what I would say, David, is not everybody that gets exposed to a particular substance in their life has problems. Think about a guy in a brake shop breathing asbestos. If asbestosis was a big problem, everybody who ever worked at a brake place would be sick with asbestosis. That's not what happens. So after the break, I'd like to come back and just have one more sentence about this topic.
All right. In the meantime, we're going to take a quick break. You are listening to the Dr. Doug Thompson radio show, where we're talking about oral health and disease prevention. If you have a question, you can reach out to the doctor by calling us directly at 800-859-0957. Don't miss this opportunity to talk to the doctor and ask your questions directly. You're listening to the Dr. Doug Thompson radio show on 760 WJR. And we are back on Facebook. I think that we got cut short a little bit.
I'm not sure what you mean.
Well, he went to break before you were done.
No, that's okay. We're just into a few seconds. We'll come back. I'll finish this concept with David. It's
Yeah.
perfect. It's a great question because this is a really big area, I think, of misunderstanding, and it's a really big area of contention with us in dentistry from those that want to be preventive and those that want to be holistic, or those that want to be biometric, or they have certain names for their particular study. And I want to be practical.
What's a holistic dentist?
Well, there's no official accreditation for holistic dentistry, but there's groups that teach environmental toxins and different chemical toxins in the products that we use, and like mercury in amalgam. That's the really big one.
Mhm.
And we all know that mercury's in fish in the Great Lakes, and if you're a pregnant woman, you should limit your servings of Great Lakes fish to only a certain number of servings per week, because there's mercury in the fish. And
Mhm.
we even know that now in our large fish that there's mercury, because they eat smaller fish that have mercury. And so there's
Mhm.
certain environmental toxins that we have to avoid. And so there's groups of people that teach dentists about the whole area of biology and environmental toxins and what you should avoid. But I can tell you, most everything we use in dentistry is quite toxic if you use it wrong. So,
Wow.
but used appropriately, it can be managed, very safely.
Mhm.
So the problem, and the answer to David's question when I come back from the break in just a few minutes, is going to be the use of fluoride has to be risk-based. You have to decide if you'll benefit from some topical fluoride, that's going to be smart. But should you have to drink it? Should you have to eat it? Should you have to put it in your body? Maybe not. Maybe not.
Mhm.
And that's the idea. So somebody who understands that needs to make that decision.
Mhm.
It can't just be left to, oh, you shouldn't have fluoride, or oh, you
Mhm.
should, or you shouldn't have this. I mean, too much
Mhm.
sun is a bad thing, but you should get some for vitamin D.
Right, that's
So how
true.
much do you need?
How
You need to
much?
get
That's
skin
true.
cancer or vitamin D?
Right, that's true.
Your choice.
Yeah, I mean, that's absolutely true. I mean, you just don't know. You have to, there's a good and a bad side to everything, but I mean, it's all about information and it's all about education and, it's all about being connected to a doctor or a dentist or a healthcare provider that's in the know. And they can,
Yeah.
because everybody needs to be shepherded down a path, and the sad thing is so many people are in the wrong path with the wrong doctor and the wrong, yeah,
Yeah. And we have tests that can help us tell if somebody has too much toxicity to, to whether it be fluoride, mercury,
mm-hmm,
whether it be other substances. We can help them determine that. And believe me, we don't want to overexpose anybody to anything.
mm-hmm. This is the last segment, so I do want to touch on your test for sleep apnea.
Okay.
And its connection to heart disease. But we'll come back to David.
We can do that. And for well, I'll wait until you introduce the next segment. But for any of the Facebook people, do Facebook people get to ask questions or not so much?
Yeah, they usually do.
We don't have any questions.
Yeah,
Okay.
sometimes we get a stream of them, and whoever's
Can do it.
doing this answers them.
Yep.
Welcome back to the last segment of this special live radio show with Dr. Doug Thompson. I'm your host, Anne-Marie Cronin, and we are here tonight talking with the doctor about his state-of-the-art clinic and his practice of prevention in dentistry. This is our final segment, so if you have a question for the doctor on the topics we're discussing tonight, please give us a call at 800-859-0957. We're going to come back. Dr. Thompson, you wanted to quickly finish up with Dave's question?
Yeah, I like, Dave from Windsor asked a question about fluoride. And Dave, kind of my final assessment or my final comments on the fluoride is all of us can get exposed to things that can be hurtful, but we can also have limited exposure to things that can be very helpful. And so one of the things that we want to do is make sure that the assessment of whether you should or shouldn't use that is risk-based. And that's going to be personally dependent. So I think that you need somebody who can figure that out, because it's not going to be smart for us to say that something is bad for all of us, because that's not really true. And on the break, we were talking to our Facebook listening audience, and it's like sun exposure. I mean, hey, if you need some sun for vitamin D, but if you get too much sun, you get skin cancer. So, what's it going to be? You have to make a decision. And I'm not going to tell everybody to avoid the sun, because sometimes it could be a little bit healthy for you, but too much of it can be unhealthy for you. So we no longer prescribe fluoride tablets in the water. We know there's places in the world where the wells are too concentrated with fluoride. So the important part is to make a risk assessment and determine what's right for you. So I hope that helps with your question, and I'm sorry it couldn't be a little bit simpler.
Well, nothing simple, but it's always good to have the information, however it's delivered. But let's continue on about your practice of prevention. One of the other things that I'd like to talk to you about is sleep apnea, your test for sleep apnea, because I think most people don't understand there's a strong connection between sleep apnea and cardiac disease. And we're looking for preventing heart attacks. 700,000 men died of the widowmaker last year, according to the CDC, and we want to try to turn those figures backwards and around. So what can you tell us about what you're doing with your test and your practice for sleep apnea?
Yeah, it's really important. We've identified already the significance of gum disease. And if you haven't listened to our Sunday show, our past Sunday show was on cavities and cavity prevention. And cavities are another biofilm disease that's caused by bacteria that live in the mouth. The third big thing that we really want to make sure that people are not struggling from is some kind of airway issue when they sleep. So sleep apnea, or upper airway resistance syndrome, or sleep disordered breathing, these things start when we're really little. So children, if you have children that make sleeping sounds, children that grind their teeth, children that make sounds in the night, bedwetting, these are things, bedwetting beyond, an appropriate age. These are all signs that sleep is disordered. And so in the world of sleep apnea, not only do we have tests that we can do in the dental practice that are very easy, and we're going to get to that in a second, but it's identifying some of the anatomical or some of the things that are even just that are basically indicators of our facial development that could put us at risk for sleep apnea. Things like tongue ties and narrow palates and certain anatomical things. So even when chronic chapped lips and kids who mouth breathe. So when we see these little things in children, these things in little children, we already know, it's a big problem. If this goes on into adulthood, then we know that some of these people could have breathing issues. So that would be now snoring. It would be lack of restful sleep. It would be I don't feel like my sleep is really refreshing, and I'm having trouble staying awake during the day. So we have questionnaires or surveys that help us determine who might be at risk for this, especially after seeing certain anatomical issues. And then if we feel like someone should be tested, then we have some very simple things they can wear on their, like tests they could take home and wear on their finger at night, and it could give us a lot of data. Or we have wristwatch style tests for less than $200 that they could wear at home, and they could determine if they have sleep disorder breathing or sleep apnea or one of these issues. And if they do, and if you're not getting the appropriate oxygen at night, you can have significant cognitive issues, behavioral issues. It leads to heart disease. I mean, there's many different diseases that are affected by poor oxygen at night while you're trying to sleep. So sleep is critically important.
And no one knows that. That's what's so amazing. The small percentage of the population that have heard about sleep apnea, again, most of them are thinking about spending the night in the hospital or in a clinic and then getting a CPAP machine, which we know a lot of people then pitch it after they have it for a while. But what I like about what you're doing is they take this glove home or this device home, they sleep in their own bed, you get the results, and the benefits are overwhelming, the benefits that you're getting.
Well, believe me, we want to get them to the right people that can help them. And sometimes we can, there's simple things we can do. So to think that the CPAP is the end all is not necessarily the case. And to your point, Anne-Marie, many people end up being non-compliant with that device. So I'm not suggesting it's a bad device. I'm just suggesting that there's other alternatives that need to be investigated. And who would have thought? I mean, who would have thought not that long ago that you could find this out at your dentist office? I mean, that's the amazing thing.
Well, I think that it's a misunderstood concept. Sleep apnea, most people don't even know what it is. They also don't know how dangerous it is. And they also don't realize what the connection between sleep apnea is and all these other diseases, all these other conditions that are detrimental to your health and sometimes deadly. So I think that everybody needs to wake up and realize that these tests are simple, they're easy, they're inexpensive. It doesn't matter that they're not covered by insurance. We're talking about, 100, 200, 300. Each test in and of itself gives you an immense picture of where you are with your health that you're not going to get in your primary care physician's office.
Yeah, and believe me, we don't offer or we don't recommend any tests that we don't think you need. So when people come in, they don't necessarily have to get all the tests. If you're healthy and you have a great balance in your life in this one particular area that we talked about where we have testing that's offered, we wouldn't recommend the test. We only recommend the test for people that need it. But believe me, going back to sleep apnea, when you think about what happens when you're drowsy, I mean, when you're driving and you're drowsy and you're falling asleep or you're trying to write a paper or think or do something important, fly a plane or whatever that is, and you're drowsy and you're falling asleep, many of these national catastrophic accidents have happened because people are drowsy or they're falling asleep because they don't have good sleep quality at night. And I can tell you, if you have sleep apnea and your sleep quality at night's not great and you're drowsy during the day, you might as well be drunk. I mean, it's very, very dangerous. And so we want to make sure that we have restful sleep, that we have good refreshing sleep, and that people are benefiting from the time they spend in bed.
I think the message here is that everybody should line up and get these tests. Certainly the oral diagnostic test for all the pathogens in your mouth that create disease, and also certainly the sleep apnea test, as well as all the other diagnostic tests that you're doing as part of your dental practice. We have 25 seconds to
Well,
say.
sometime we should come back and talk about the new tests we have for pregnant women and the tests that we have that could identify the harmful bacteria for expecting mothers and fathers that can affect their young unborn fetus. It's amazing what's happening in dentistry today, and I'm happy to be part of it.
And you'll also want to tune in to Dr. Thompson's show on Sundays at 3 o'clock. Unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Thompson for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. To learn more about his practice, you can reach him directly at 248-642-1000. Again, that number is 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope that you've enjoyed this special show and that you've become more informed about oral health and its impact on the major diseases of our time. Good night, and thank you for listening. It's weird how the timer's kind of